House Speaker Paul Ryan and Vice President Mike Pence have been making the rounds on Capitol Hill, trying to sell their bill to repeal and replace Obamacare. But President Trump is stumping for the plan in a familiar way in front of a crowd of his supporters. He was in Nashville Wednesday night, and next week he's expected to hold a rally in Louisville, Kentucky. But will it be enough? Some Republicans are distancing themselves from the bill after the CBO report showed 24 million people would lose coverage in the next decade. The GOP may have a majority in the House, but the bill will fail if only 22 members oppose it. Indiana Congressman Larry Bucshon joins me now from Capitol Hill. Congressman, thanks for being with us.
Thanks for having me.
Do you think that the president is doing enough to promote this bill?
I think he's doing a lot, and I also think the vice president is doing a lot. The vice president was on Capitol Hill yesterday talking to Republicans on both sides of the Capitol, and so I've been very pleased with the president sticking with Republicans with our promise to repeal and replace Obamacare. So I'm very pleased that the president and the vice president are out there getting that message to the American people.
And do you think that the administration will be able to move the bill to a place where more conservatives are comfortable with it?
Well, I mean, I think that's part of the legislative process. You know, as you know, today it went through the House Budget Committee and passed. You know, we had a few people that didn't vote for it on the Republican side, but now as it goes to the Rules Committee, it's an ongoing discussion that we're having amongst House Republicans about where the best place to be is for this legislation. Look, that we make sure that people that are currently on the health care exchanges and on the Medicaid expansion don't lose their coverage. But we also want to get back a free marketplace. And this is just the first step in a really a three-step process that we need to go through on Capitol Hill and honestly at Health and Human Services to accomplish that goal. You know, Obamacare is failing. The exchanges are going away over the next few years, and that's not my opinion. That's the opinion of many out there, including many prominent health insurance company executives. So we want to keep our promise to the American people. We want to do it in a way that doesn't pull the rug out from under anyone. But we want to have the future of health care more affordable for everyone and have all of our citizens, like the president has said, have access to quality, affordable health care, and that's my goal.
You talk about this bill being a first step. House Speaker Ryan, of course, as you know, says he's open to refining this legislation. What needs to change, you think, to get more members of your party who may be still skeptical at this point on board?
Well, for example, we have 31 states that expanded. Some of those are Republican states, but we also, the Medicaid program, and there's states that didn't expand. So, you know, there's a little bit of a difference of opinion between those groups of members, but look, we're very close. And so we have an ongoing discussion going in the House and on the Senate side to get to a place where Republican members can support this repeal and replace. I think it's very important that Republicans keep our promises, and so does the president. And we've been campaigning, I have at least for about 7 years, on replacing the Affordable Care Act with more affordable options that's not a government-run program that gives the American people choice. And, you know, some people may choose not to have health coverage, and that's their freedom to do that. But we want to make sure if there's low-cost options on the marketplace, most of the American people will see the utility in having health coverage and will choose to do so.
Well, if this bill, in fact, does pass, some senators have hinted that they would make alterations to it. I wonder, Congressman, is there anything that would be a deal breaker for you?
No, I mean, I'm not going to, say that anything's a deal breaker at this point. The Senate has their process. They need to go through their legislative process. And I expect some amendments on the Senate side. And that's the legislative process. And then we can work out the differences between the House and the Senate to get to a place where we make sure that every American has access to quality, affordable health care. And I'm confident we can get to that process. And it has been important that the president and the vice president, as well as Secretary Price, have been having an ongoing discussion with the American people about why Obamacare is failing and about why we need to act.
Well, finally, Congressman, the White House released what it's calling an America First budget proposal Thursday. It includes some steep cuts to the State Department, the EPA, and the Labor Department. What did you make of the president's first budget proposal?
Well, at this point, I'm just going through the details. I mean, I think there's positive things in there. I think everybody on Capitol Hill knows that we need more money to train and equip the best fighting force in the world through the Department of Defense budget. But we also know there's other important programs out there. One of the things I think is important to recognize is that we want to decrease the size of the federal bureaucracy. And so we'll see where that goes. The House will produce our budget, and we'll work with the White House, both the House and the Senate, to get a budget that is appropriate for the American people. So I think it's early in the process. I'm glad this president has released a budget on time so that we can look through it and the American people can see it in the light of day, and then we can work through the process.
All right, Congressman Larry Bucshon, thanks very much, Congressman, for your time. Appreciate it.
You're welcome. Thanks for having me.